I'm Roger DeRose. At Kessler Foundation, we're committed to changing the lives of people with disabilities through research and employment strategies. And that's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of Caucus, New Jersey has been provided by the PNC Foundation, which supports early childhood education through Grow Up Great, a multi-year initiative to help prepare children from birth to age 5 for success in school and life. The New Jersey Education Association, NJIT, New Jersey Institute of Technology, PSC&G, committed to improving New Jersey's economy and strengthening its communities. Kessler Foundation, changing the lives of people with disabilities. Adler Aphasia Center, helping stroke and brain injury survivors recover their speech. And by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation.
Hi, I'm Steve Adubato. A really important subject we're going to be talking about today with the gentleman you're about to see on camera, Dr. Rainier Aquino, a vascular surgeon, Meridian Cardiovascular Network, Jersey Coast Vascular Institute. Doctor, we were just talking about this right before we got on the air, the subject of aneurysms. Huge topic, affects millions of Americans and little understood. And I tell you, I have some family history here that I'm not going to talk about on the air, but I'm not alone. Talk about this issue.
Well, first, an aneurysm is a disorder where your normal blood vessel starts to balloon out or bulge out and expand. And the potential is that when it continues to expand, it can burst. And if it bursts, you can have severe internal bleeding that can lead to mortality, lethal issues with that. And it's a common disorder. It affects Americans, 1.5 to 2 million Americans in this country. 200,000 cases are diagnosed by physicians every year, of which 15,000 are potentially lethal because it can burst. So it's something that's fairly common. Also, 10th leading cause of sudden death overall in this country in males.
Why more men than women?
No one really knows why, but generally for the male population, it affects about 2 to 5% of males over the age of 60, so that becomes a risk factor. Males have a 4 times more risk of developing these aneurysms, although overall aneurysm population, about 20% are females. Other risk factors such as smoking. Smokers have a 7-time increased risk of developing these aneurysms. Smokers. Those former smokers have a 4 times increased risk. And also important is family. There's a 20% genetic link with family members. If you have a father, a mother, or brother, you should find a board-certified vascular surgeon and be evaluated for these aneurysms. And aneurysms, again, can affect any blood vessel in the body, from the brain to the legs. More commonly, it affects the largest blood vessel in the body, and that's in the chest or abdomen.
The chest or abdomen. Let's talk this through. Can we get a shot of this team? Let's take a look. Dr. Aquino, help our team make sense of this, because without you talking about it, we're not going to be able to. Describe what we're looking at right now.
The largest blood vessel in the body is the aorta, and this is the aorta, which is in the abdomen. Its purpose is to give blood to the lower extremities, the lower part of the body, and the abdominal viscera. When typically the size of the aorta is about 1 inch, about 2 centimeters. When a segment of the blood vessel gets diseased, it starts to bulge out and expand, and this is what's known as an aneurysm. When it expands more than its safety margins, then it becomes a critical health risk, because these can, obviously, as you can see in this, it can burst.
Now, what are we looking at right here, doctor?
At the level of your belly button, this is where your artery splits into the left and right iliac arteries that provide blood flow to your extremities.
Got it.
Okay, and
so let me ask you this: the biggest danger here is that if someone doesn't monitor, if someone's not aware, that they have a potential problem, an aneurysm in this area, and it bursts, can you deal with it, or is that it?
There's poor survival in that situation.
Why?
Well, it's massive blood loss internally. They may not think that it's an aneurysm, but it's just abdominal pain and back pain. And by the time they get to the emergency room and then the operating room, it may be too late. So patients can experience severe back pain, abdominal pain associated with shock, loss of consciousness, dizziness. All those can occur in that emergent setting, and they have to get into the hospital as soon as possible.
But you know, what's interesting about this is I also think about prevention, okay? I mentioned to you, without going into a lot of detail, that the doctor had picked up. He said, you have a microscopic aneurysm. And it wasn't in that spot for me. It was more in the leg area, he said. I said, oh, okay. He said, well, I want this checked out. And he was very specific about what he wanted done. But in all candor, until I was getting ready for this show, I wasn't thinking about it much. Now you have me thinking about it a lot. I'm thinking, well, what do you do? Is there medication? Like, say it's the right physician, the right circumstance, what happens?
There is no medication. It's not going to go away. It's not going to stay, where the size that it's at. It's going to continue to grow in this area.
Because that's what aneurysms do?
That's pretty much what it does. It's a weakening in the wall, and it's going to continue to expand and expand until it can't expand anymore, and that's when you have, when it bursts or rupture. So, in general, in the abdominal aorta, it grows about 4 millimeters a year, and so it's important, and that's key, to continue with your physician to monitor its growth, whether it's a 6-month ultrasound,
right,
yearly ultrasound. You continue to monitor its growth until it needs to be fixed, and generally
Define
in this
fix.
area, that's about 5 centimeters.
Fix.
So when we fix it, it's either two ways. There's a traditional surgery, which is the big incision in the abdomen, and we replace this segment by hand with this durable man-made tube-like structure. That's, over time, it's about 90% successful. Now, the recovery in the traditional approach is a lot longer. Patients generally go through a lot depending on their circumstances, depending on their comorbid risk factors. The newer approach, which has been around for about 20, 25 years now, is fixing it, not from the outside as we would with the traditional approach, but from the inside, as depicted in this figure, this model, where we would make 2 small incisions instead in the groin and deploy this stent graft from the inside with live X-ray. Generally, recovery is 1 day.
Really?
At least in our practice, we send our patients home in 1 day, but baseline quality of life returning to function is about 4 weeks.
You can't ignore this stuff.
Right. But overall, those are the 2 options for addressing these aneurysms.
Aneurysms cannot be ignored. You cannot cure it, but you can monitor it and stay on top of it, correct?
Yes.
Dr. Aquino, Vascular Surgeon, Meridian Cardiovascular Network, Jersey Coast Vascular Institute. Thank you, Doctor, for joining us. We appreciate it.
Thank you.
Important medical information, health information. Stay with us.
To see more Caucus, New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato PhD. And follow us on Twitter at Steve Adubato.
We're pleased to welcome our friend Bob Marino, Chairman and Chief Executive Officer, Horizon Bluecross, Blueshield, New Jersey. Bob, good to see you.
Good to see you, Steve. Good to be here.
We fully disclose, and we want to fully disclose that you are a member of the board of public television in the state of New Jersey. But we're not here to talk public television. We're here to talk about the changing landscape of healthcare. But we often talk about we're moving from what was called fee-for-service to a more, quote, patient-centered care model. And I'm asking myself, haven't we always done that? Or what's different? Talk to us.
Sure. Well, you're right, Steve. What we're doing and what Horizon's committed to doing is really changing the way healthcare is delivered and paid for in the state of New Jersey. Today, healthcare is delivered and paid for in New Jersey, as it is throughout the country, on something called a fee-for-service system. And as the name suggests, the way the reimbursement works, the services or more services you do, the more reimbursement you collect. Fundamentally, it's not a sustainable economic system. So we need to move to something that creates more value for the healthcare dollar. So Horizon is very committed to transforming how we pay for and deliver care from fee-for-service to what we call fee-for-value. So people will always ask me, well, can you define value? What does that mean? So we define value 3 ways. The first way we define it is that we have better outcomes and improved care. The second thing is we have more patient involvement, better patient experience with the delivery of care. And third and importantly, we're able to lower the total cost of care. So when we talk about transformation, we want to move from this unsustainable fee-for-service system, which basically does not provide coordinated care. Essentially, it's an inflationary kind of system, to a system that rewards value. And again, value being defined as better quality, better outcomes, better patient experience, and lastly, lower total cost of care.
Bob, it makes sense, logical, but I'm asking myself, what does it mean, what could it mean for patients on the other end of this?
It's a fair question, and here's what it means from our perspective. Number one, patients will receive better care, more coordinated care.
What does that mean, more coordinated?
More coordinated care. Today in our fee-for-service system, care is delivered on a very fragmented basis. I'm certain you know of stories of folks who see one physician orders a series of tests, see another physician, and another series of tests are ordered. Uncoordinated, fragmented care. So when we talk about patient-centered care, we're really talking about a primary care physician, a family care physician, coordinating all of the needed care for that patient, ensuring that the patient's getting the care in the right setting, at the right cost, at the appropriate time. Importantly, when a physician practices what we call patient-centered care, they act as sort of like the coordinator of the overall health care for all of the patients in their panel, if you will. And instead of just going in to see the doc because you've got, an acute bronchitis, your doctor, when he or she's practicing patient-centered mental care, is really looking out for your total well-being, making certain that you're getting the right preventative care at the right time, et cetera. And as we're able to transform the delivery system to do that, patients will see improved care, more involvement with their care, appropriate care at the right time, at the right place, and importantly, lower total cost of care because services are being better coordinated.
Bob, you've said, and I've talked to a lot of your folks, the other thing is I've done a lot of leadership development, coaching at Horizon, so I've gotten to know your people a lot. And one of the things that your people tell me is that one of the challenges they face is communicating a lot of what goes on in health care and health insurance to the average consumer. How much of this, frankly, is a product of communication and breaking things down so the, quote, average consumer can get it?
Steve, you're right on point. I think one of the biggest challenges that we have in healthcare, it's a very complicated, complex business.
By design?
Well, healthcare is a lot different than, if you will, manufacturing number 2 pencils. It's a lot more complicated, if you will. And I think one of the challenges we have is that we speak a totally different language than the average consumer. And I think the challenge for us and other organizations in our business is we need to speak a different language, need to make it simpler, less complex for members and consumers to understand. When you talk about concepts like patient-centered care, folks say to me, are you talking about nursing homes? No, we're really not talking about nursing homes. So there's a lot more work we need to do to really communicate the message, simplify the message, and make the end consumer, the user of healthcare, really understand what we're talking about when we talk about transformation of healthcare.
I'll tell you, I'll go back to how you started this conversation, the economics. One thing everyone understands is when you can't pay for things. You said the system, fee for service, is not economically sustainable. Please help us understand that again. Why is it not sustainable? Why can't we just keep doing what we're doing?
Well, because to be honest with you, when I talk to employers, I talk to small business people, I talk to individual families and consumers, and they find out what I do for a living, the first thing they will tell me is, we just can't afford this. It's too expensive. What are we doing about controlling the cost of care? And fundamentally, we need to change the system. The system of fee-for-service is a system that grew out of perhaps World War II when employers first started offering health insurance coverage. And by design, if you listen to the words fee-for-service, it means the more services I do, the more fees I collect. It's not producing the value that we need in healthcare.
Excuse me for interrupting. The more tests ordered, the more I get paid. Doesn't work.
Doesn't work. It's not sustainable. New Jersey, unfortunately, is probably one of the states with the highest cost of health insurance and certainly one of the highest cost of health insurance premiums. Some of this is driven by the fact that the current system of fragmented delivery of care, which we have through the fee-for-service system, simply isn't sustainable. When we look at medical inflation, Here in New Jersey, medical inflation probably runs somewhere between 5 to 6% a year. Compare that to general inflation that runs a little over 1%. So even though people talk about, well, the rate of inflation in healthcare is coming down, it's still a big number when you compare it to the overall consumer inflation. So we need to fundamentally change the economics in healthcare. We need to move healthcare more towards a value-based system where reimbursement is based on the quality of care, the outcomes that are produced, the patient involvement, and then lastly, lowering the total cost of care.
The reaction you've gotten, you were talking to our news anchor, Mary Alice Williams, about some of these issues, and one of the areas that you started to get into, I want to follow up on, is the reaction you've gotten from the others in the healthcare community, more specifically, not just the physicians, but the hospitals. On board?
Clearly they are. You know, we're really excited about the work we're doing. For the last 3 or 4 years, we've been collaborating with key physicians and hospital organizations. We now in New Jersey have the largest network of patient-centered medical home physicians. We have over 6,000 physicians that are involved in patient-centered medical care delivery. We also have a series of what's called accountable care organizations and episode of care. These are very new innovative payment models of how we pay physicians in hospitals that really puts the focus on the quality as opposed to the volume. Results, we're very encouraged by what we're seeing. For example, we did a study in 2014 based on 2013 data. We took 200,000 of our customers that are getting care through patient-centered medical homes, and we compared them to 200,000 comparable patients who are not getting care through patient-centered medical home. And the initial results are encouraging. For example, we saw for the 200,000 people that were getting care through patient-centered medical home, 14% improved rate of diabetes management, 12% improved rate of cholesterol management, 8% higher breast screenings, 4% higher screenings for colorectal cancer. So the indications are positive. When you look at some of the cost metrics associated with this, we found that those 200,000 members in patient-centered medical homes, 4% less visits to the emergency room, 2% less admissions into hospitals, 4% overall lower total cost of health care for these 200,000 members compared to 200,000 that are not in patient-centered.
That's optimistic.
Very optimistic. We're encouraged. We're encouraged. We're committed to this. It clearly is the strategy of our company to lead the transformation of healthcare from fee-for-service to fee-for-value over the next 3 to 5 years.
Bob Marino is the Chairman and Chief Executive Officer of Horizon Blue Cross and Blue Shield of New Jersey. We'll continue this conversation as this transformation in the healthcare world continues. Thank you, Bob, for joining us. We appreciate
Steve, thank you. Thanks for having me.
Stay with us. We'll be right back right after this.
To see more Caucus New Jersey with Steve Adubato programs, visit us online at steveadubato.org. If you would like to express an opinion, email us at info@caucusnj.org. Find us on Facebook at facebook.com/Steve Adubato, PhD. And follow us on Twitter at Steve Adubato.
We're pleased to welcome Veronica Ray, Executive Director and Chief Executive Officer of the Leaguers Incorporated in Newark. For those who do not know the Leaguers, describe it.
The Leaguers is a private nonprofit social service agency that's been around for almost 69 years now. Founded by Mary B. Birch years ago up on Clinton Avenue.
Yeah, in the South Ward of Newark, New Jersey.
Yes.
As a young boy growing up in Newark, my dad, who was heading up a big social service agency, used to take me up to Leaguers because they were the role model for what a social service organization should be, right?
Absolutely. And a lot of Newarkers have come through there, such as Congressman Payne was a member.
That's right.
And
Congressman
Hazel
Donald
O'Leary,
Payne, his brother Bill.
And Bill.
You know,
Hazel O'Leary and a few others.
But the other piece of it with the Leaguers has to do with Head Start.
Yes.
Let's talk about Head Start. Describe Head Start and why its 50th anniversary is so significant.
Head Start. Leaguers has been providing Head Start services for 45 years. But why is Head Start's 50th anniversary?
First of all, what is Head Start for those who...
Head Start.
I don't even want to assume everybody knows what Head Start is, because I think people know, and then they go, what exactly is that? Not everybody knows.
Head Start is a developmental and educational program now for children 0 to 5. It started out 3 or 4-year-olds way back in the day, 50 years ago, under the anti-poverty program.
Was it part of Lyndon Johnson, Great Society
Great
initiative?
Society,
Right?
yes it was. And it's lasted 50 years. But it's lasted 50 years because it works. It works not only for the child, it works for the entire family. And it works for the community. So,
Define works, because it's interesting. People say, well, what does it mean to work?
to work, it means that Head Start is touching lives. It's helping children grow positively. It's helping families grow positively. It's helped lead a lot of families out of poverty because
How do you lead them out of poverty?
by
Head Start?
helping them set goals, family goals, goals for their children, and then helping them achieve those goals. Helping them to understand that you cannot eat the whole pie at one time, but you cut up the pie and you develop goals where you take baby steps and you keep moving on and on until you have accomplished your goals. And I can explain that by saying we've had some parents who came to us without a high school diploma who now have master's degrees and who now work in that same program.
Head Start a part of that?
Head Start. They came as Head Start parents without a high school diploma, who now have master's degrees and are serving on that, who now sit on the board of trustees. So
That's powerful.
that's powerful. And they now help run these programs.
You know, I grew up, as I said, in the other end of the city. This is the south. For those of you who don't know Newark, it's got 5 different wards, and
Yes.
it's an interesting little city, 22 square miles. The South Ward on one end, the North Ward where I grew up, very different communities. But I always remember when I drove through the South Ward, it was a very stable community, residential community, but always struggles, right? Always challenges.
Always.
So for those who don't understand the socioeconomic challenges and struggles that a child is, you know, from birth to 5 could be potentially dealing with, likely to be dealing with, let's just say in the communities we're describing in Newark. Talk about that.
Today's children, where the South Ward used to be single-family homes and single families, there are now 2, 3, 4 families living in those single-family homes, and then that child is in that environment. They may be sharing the bed with 3 or 4 other people. The gang issue is a big concern to us in the South Ward.
Violence.
Violence.
Drugs.
Violence, drugs. It never ends for these children. Some of these children, the only meal they get is coming to our child care centers, making sure that they have breakfast, lunch, and a snack. And some of them, clothes is an issue.
Clothes.
Clothes, shoes is an issue. And then making sure that they get medical services was a big issue. It's better now, but it was a big issue. Prenatal care for pregnant women. The lack of doctors in the city of Newark and in the South Ward. I don't have the statistics for the last 2 years, but before that we had 1 practicing pediatrician.
One
One
in the community.
in the community. Just
Serving
one.
all those children.
Serving all those children, just one. So we had to take children outside the community for medical services. So our children have a hard time, you know,
So we
growing
expect
up.
them to, quote unquote, as we say, you know, you say, grow up great.
Grow up great.
And growing up great, is it more difficult to, quote unquote, grow up great for these children than it is for the rest of, for other children who grow up in different communities with certain advantages?
I would think so. I think it's difficult for these children because they aren't given the same advantages, and that's why we're here to help bridge that gap.
That's what Head Start does in large part?
That's what Head Start does, help bridge that gap to make sure that they are getting the preventative services that they need, the medical services that they need, early intervention, the mental health services that
Why
not only
mental
they
health?
need. Mental health? Why?
For a child?
For a child. For a child. There are children who need to learn how to express their anger, okay? Believe it or not, bullying starts at a very early age, and we need to help children redirect that energy and learn to use words instead of bullying other children. So mental health plays a good part of what we do. The other thing is such things as play therapy, where we stop trying to label children all the time as being ADA or ADD or whatever it is,
Right.
and try to help them work through all those issues. So mental health plays a large part on what we do.
I'll talk to you. The fact is that as I think about this, Head Start may be turning 50 and the Leaguers of Newark 60.
69, yes, we'll be 69.
Yeah,
next year,
the late, great Mary Birch started it, and you and your colleagues are at it every day, making a difference in the lives of these children. Veronica Ray, who is Chief Executive Officer of the Leaguers Incorporated in Newark, thank you so much. We appreciate it.
Thank you for having me.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the PNC Foundation, which supports early childhood education through Grow Up Great, the New Jersey Education Association, NJIT, PSE&G, Kessler Foundation, Adler Aphasia Center, and by New Jersey Sharing Network. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com. And by NJ Biz, all business, all New Jersey. Transportation provided by Airbrook Limousine.
I think at NJIT there are a lot of smart students.
I came to NJIT for mechanical engineering because with in-state, it's one of probably the top 3 schools for engineering.
It sort of creates a friendly competition where you can learn from them.
It's a great academic school.
I feel I'm being challenged, but at the same time, I love the classes I'm taking.
The atmosphere of being here is like being at an upstart company. It's that same kind of drive, that same kind of passion.